Hello, I'm Nelson Liu, and thanks for joining us for Western Perspective. Well, he's been called WA's wartime premier in the battle against COVID-19. Mark McGowan's popularity has grown among Western Australians as he deals with the pandemic, with decisions that has kept coronavirus case numbers low in WA, preventing the spread of the virus. This week, I talked to political expert Dr. Ian Cook at how Mr McGowan's popularity has risen during this difficult time and what it means for his leadership in the future. Premier Mark McGowan has been leading WA through the COVID-19 pandemic. What's your take on how he's handled it in WA?
I think Mark McGowan has done pretty well in terms of the sort of public response that people have been looking for. So, I mean, it took him a little while. I thought it was a little bit sort of hysterical around the cruise ships and sort of didn't quite get the right tone. But I think he sort of subsequently got the right tone, and I think he's giving West Australians the sort of leadership they've been looking for, and I think they're sort of responding to that.
His approval at the moment is quite high. In fact, it's at 89%. Why do you think he's gotten such a positive response?
It's not unusual in circumstances like this to have people sort of getting behind their leaders. So in times of crisis, we generally see these sorts of boosts for the leaders' popularity. So I think in part it's simply a reflection of the fact that people are getting behind their leaders in a time of crisis. I think it's also the fact that people are responding to the way McGowan's presented himself, and that McGowan has sort of shown that that he's steady and stable, and in some ways the sort of Mark McGowan I've been expecting. That in a sort of crisis moment, he's been relatively calm, relatively subdued, and people I think are liking that.
What do you think has gotten him there?
Well, I mean, I think partly his relationship with Andrew Miller, I think, is helping in terms of getting understanding what the doctors are looking for, understanding what the people are looking for, and finding sort of the right way of presenting that. So I think it's partly the sorts of people he's been working with. I think his sort of personality has been helping him. But he has the right sort of personality, I think, for these sorts of situations. So I guess a sort of combination of those sort of factors.
When we look back at some of the state government's missteps in the past few years, has how he's handled COVID-19 erased some of the bad feelings by people who thought that those mistakes were big enough to turn away from him?
I think that certainly he's got, Mark McGowan is somewhat more popular. How long he can hold on to that popularity, whether people will forget and start remembering some of those missteps and some of the questions around corruption and some of the problems we were getting in some ways just before the COVID-19 virus really hit. So I think that I'm not sure people will absolutely forget. I think certainly he's got goodwill toward him. If he can keep sort of reminding people he does want to work on these issues around corruption, he is responding to people's interest in those other factors, then I think maybe he'll hold on to the support. But, there is a chance that people will sort of remember those past missteps and when they come to vote next time around.
Is what he's doing going to be enough to get him over the line?
I mean, I think Mark McGowan is in good shape. I thought that given the sort of win he had in this last election, really strong one, this is one that's going to survive at least a couple of electoral cycles. So I'm certainly expecting to win this forthcoming election. The COVID-19 has helped, I think, in terms of his popularity and where the Labor Party is positioned at the moment. So they're looking very good. A week is a long time in politics. Anything can happen, but right now you're putting a lot of money on Labor.
What would be his downfall?
I think he needs to be careful not to get arrogant. I think they need to be careful not to present Mark McGowan as a sort of charismatic leader. They tried to do that just after the election, when they were sort of going through by-elections, and they tried to make McGowan a sort of the leader and make him a different personality. He's got to stay relatively humble, he's got to stay relatively subdued in his delivery, he's got to say the solid Mark McGowan. If he can do that, then I think he'll be well placed, and I can't see the Liberal Party mounting an opposition that's going to be effective in removing him.
So at this point, the state election is around the corner. In fact, it's less than a year away. Even though everyone is thinking about the coronavirus in front of us, what do you think is going to be the future for Mark McGowan at this point?
I think economics is going to be crucial, because economics affects people's sort of voting practices. So we're going to have to look at some of the economic consequences. As long as he can be seen to be in control, I mean, it's great having Ben Wyatt staying on as Treasurer to maintain that sense of stability, and we've got it, we're in charge and we're going to stay in charge. So I think that, it's that presenting those sorts of images, that sort of representation, and keeping that going forward. As I say, I think that this is highly effective as an electoral campaign, and I don't think the Liberals are going to be able to counter that.
And finally, does he stand a chance at the next election?
I think that I don't think he can maintain the level of support that he got in the last election. I'm expecting that Labor may lose, a few seats. It won't be nearly enough to get them out of office. The real question for the Liberal Party is, will they put themselves in a place where they can win in the following election? And that's the question I think we're going to be asking, looking at this next state election.
Dr. Ian Cook, thanks for talking to us today.
My pleasure.
And now, AMA WA President Dr. Andrew Miller gives his commentary on this week's COVID-19 issues.
Hi, thanks for your time. Bit of a surreal landscape this week with coronavirus, with very low case numbers in Australia, particularly here in Western Australia, 0 cases 3 days in a row, whilst we see just terrible things happening in other places. Not to minimise what's been going on with the nursing homes in Australia, and really worried that those seem to be, like cruise ships, a particularly vulnerable sort of location for people. But we do have a pretty good flattening of the curve here at the moment, so we've got the luxury to think about what we're going to do next, how we're going to slowly ease restrictions. I've been concerned to hear people say, as we come out of the pandemic. We're not out of the pandemic at all, we're just coping with the pandemic pretty well. Pandemic's still right there, the virus still knows what to do. We just have to track down the asymptomatic cases in the community, and the government's talking about getting some testing going in that regard. At the start of this, we didn't have many tests, as you'll recall, and we didn't have much in the way of PPE. Both of those situations have changed. So that, from the medical profession's point of view, means we need to change our attitude to how we use tests and how we use PPE. At the moment, doctors are under threat in Western Australia of a $20,000 fine for ordering the test for a patient that they think needs it, either because they're going to have an important operation done and we want to be sure they don't have COVID, so they don't have a bad outcome, so they don't infect the facility, and so they don't infect the healthcare workers. We think that that's insulting and ridiculous, and we need to get rid of those fines. And we need to be able to test particularly those who are coming into interaction with healthcare facilities, or who are in situations where they can't socially distance. And so it's good to see they're going to be doing some at schools. I'd like to see how many they're going to be doing, so that we can be sure there is some protection there for teachers. We know it can spread between students, as was shown in New South Wales. We know it can infect teachers, as we're seeing in Victoria and in New Zealand, disturbingly. And we know that it moves very quickly through nursing homes, which is terrible. So lots of testing, and let's get rid of all the restrictions on the nasal swabs. Secondly, is the PPE situation. Now, there needs to be a lot more empathy and understanding around PPE, that not all healthcare workers are the same, not all jobs are the same. The guidelines are always the same, and the guidelines have been set to the minimum level so that we can preserve valuable PPE. And that's a fair enough thing to do. But let's just remember that is a minimum standard, and that if people need to use more than the minimum standard because their job is reasonably different to the average, then I think that we really need to support them in that. Partly because we don't have enough evidence at this stage. People are always saying, well, we need to go back to the evidence. Well, this is a brand new disease, so no one can really come up with a whole heap of evidence. A lot of people have got good theories, right? Now, there is an old saying that is, in theory, there's no difference between theory and practice, but in practice, there is a big difference. And after you digest that, I think everyone knows that everyone else's theories about your job and what you need to do it are pretty much useless. Unless you actually do the job yourself, whatever area it is in, no one else understands it properly. So whilst a guideline is very useful to say that I might not need droplet precautions for a general conversation with a patient who comes into a reception area, if my job involves at times aggressive, uncooperative people who are drunk or disorderly or confused, then you might think, well, for that patient you'll need droplet precautions. But I don't know which patient that's going to be. And if I'm an anaesthetist and I'm going to be intubating patients time after time, you might say to me, well, that's not a particularly risky procedure from an aerosol point of view, so you're fine with a surgical mask. Well, That might be different if you're in the midst of a messy resus of a multi-trauma. That might be different depending on which team I'm working with, how long I've been working for, and how overstressed everybody is at that time. So let's just have a bit of empathy, a bit of understanding, and a bit of flexibility around all these PPE rules, and not say that's all you're getting, you just have to suck it up or leave. Because the one thing we can't replace easily is the workforce. And if workforce start getting sick or quarantined or leave, that costs a lot of money, causes a lot of disruption to the system. So everyone's a winner when there's flexibility and empathy displays and things like this. Good news that in Queensland they validated the idea of testing the sewage system. That'll get us a better idea, like we do with amphetamines, how much of it is around in the community and how well it tallies into our testing regime. Otherwise, there's been lots of politics going on, federal and state politicians arguing with each other, big public figures in media and in resources getting involved and arguing with politicians. All of these are people who make terrific contributions in their general life. They're big contributors. And so what we need is to use this period of low case numbers to get some real alignment going, realise that all the gains we've made have been based on science, been based on good medicine, been based on good decisions about the best way to fix the economy is to fix the disease, and that will also feed in then to people's mental and physical health. Look at the pride, positive goodwill that's around because we've been able to keep these numbers really low. So any sign of problems, we need to retreat. We all know what to do. And in the meantime, let's just get lots of testing sorted, lots of PPE, and stay safe. Thanks for your time.
And that's WP for this week. Thanks for watching. We'll be back again next week with another episode. But until then, it's back to you, Ivan and Sarah.
Thank you, Nelson. This week's main news again. With the election less than 1 year away, One Nation WA has changed its strategy with the appointment of a new Labor Party president, Rod Caddies. Speaking for the first time from his new position, he revealed the party's next move and spoke candidly on issues regarding to China, Australia and the coronavirus.
And that's our weekly news and current affairs. We have the latest news on our website and social media pages.
Until next Sunday after 5:30, look after yourself, stay at home and have a pleasant evening.
Take care.